A good evening, and thank you so much for making time for us here at Medi. I am your host, Mumbi Mavuti. Tonight, we are at the Kiriaini Mission Hospital. We are going to be talking about maternal and child health. With me is nurse midwife Lucy Gidai. She's going to be taking us through this topic. Yeah, so kindly, nurse, introduce yourself.
Okay, thanks. My name is Lucy Gidai. I'm a nurse midwife at Kiriaini Mission Hospital, where we offer several services in this facility. I'm going to take you through about maternal child health and also labor and delivery, and also the postnatal care. In this hospital, we offer several services regarding to the maternal health. Once we have the antenatal clinic where we take care of our mothers. Then we have a guy who comes always on every Thursday, and is the one who usually see the pregnant mothers with the high risk, the risky mothers. Those are mothers that maybe they have cesarean section, they're diabetic, and also hypertensive or any life-threatening condition. We also have another high-risk clinic that the doctors are the ones that will see those mothers 24/7. Thank you.
Thank you so much and making time for us. So mostly when we hear about maternal and child, most of us assume it all starts with conception. It all starts with I'm pregnant. But I feel like there is a lot. Is it important for people to visit a clinic? Is there something we should do in the preconception before we get pregnant?
Sure. Mm-hmm. You have to visit a clinic pre-conception. Mm-hmm. One, mm-hmm. You need to see, you have to plan with your partner. Mm-hmm. Then you visit the clinic, you see maybe the healthcare provider or the gynecologist who will take you through maybe the way you are supposed to have this. Mm-hmm. There are some treatments that are given. Mm-hmm. Like before you someone conceive, mm-hmm. There is a supplement, mm-hmm. Folic acid, that is given to mothers. Mm-hmm. We are going to see the importance of the folic acid mm-hmm. after. Mm-hmm.
So exactly what happens in this preconception clinic? Is it just a physical checkup? Is there counseling to it?
Yes. Uh-huh. The clients are offered counseling, mm-hmm. and also you assess their fertility. Mm-hmm. Yes.
How do we do that? How is the fertility assessed?
Mostly when you have the menstrual cycles. Mm-hmm. That's the first maybe point. Mm-hmm. The doctor will assess how your menstrual cycle is, mm-hmm. and also if there is any pre-existing condition, mm-hmm. and the doctor will advise you accordingly.
Mm-hmm. And during these clinics, is it possible to find maybe complications or something during this clinic that could make you advise people want to become parents that this is not the time?
Yes, mm-hmm. Definitely. Mm-hmm. Because there are conditions, maybe you screen for HIV mm-hmm. and TB. Mm-hmm. If a mother is HIV newly diagnosed and has TB, mm-hmm. first you have to give, mm-hmm. you have to treat. Mm-hmm. If they are diabetic, they are taking certain drugs, mm-hmm. they have to stop. Mm-hmm. And also you advise, you counsel the mothers, mm-hmm. Those who might be smoking, mm-hmm. that they are taking maybe alcohol. Mm-hmm. So you advise the mothers not to take alcohol or smoke, even the partner. Mm-hmm. You know, there's that passive smoking, mm-hmm. where the partner is smoking, mm-hmm. and it can affect the mother. Mm-hmm. Yes.
During these preconception clinics, is it the point where doctors decide that for this particular couple, they're going to need assistance to get pregnant, that it cannot come naturally, the way we know it to happen?
Unless mm-hmm. there's a problem, now the couple comes in, mm-hmm. and now that the time the doctor maybe now come in between, mm-hmm. and now assist the couple. Mm-hmm. Yes.
Okay. And what are some of the complications that you could find in a woman during these checkups that this preconception within the woman now that could make you advise them that you cannot get pregnant?
There are some conditions. One is like endometriosis, that one you don't have to, it affects the fertility. And also we have the TB, the mothers who are found to have the TB. The others have things like the hormonal balance, and now the doctor can now. Yes.
Oh, that's nice. I think that is it to preconception. Now, let's assume everything is okay and a couple goes back and now they are here, they are conception. What are some of the first things they are going to experience?
Okay, after conception,
Yeah.
maybe if the test is done after 2 weeks, the lady just get a positive result. One of the signs, they miss their period. And also there is morning sickness. Hii ni ile wanasikia tu kutapika, kuna mood swings, you are craving for certain food. Ile unasikia nataka kula jahe, sitaki kuona maharagwe. So those are maybe the morning sickness. And also the tingling of the breast. They feel that their breasts are heavy. And they are painful. So those are some of them. The mood swing. You feel you don't want to see this person. Hutaki kumuona at all. Some even not like to see their husband.
That happens as early as week 2.
It is now in early pregnancy. Yes.
And most people, when they get these signs and symptoms, they rush to maybe even their closest chemist and buy the test kits. Are they really accurate? Is it accurate to test at home, or would you advise people to visit clinics?
It's always good to do it in the health facility. And also, if you are able to do it, you know the procedure and all that, you can also do a home test. Then it's always good also to come to the hospital. You can do it through the urinalysis, the urine, and also through the blood. Through the blood, you can always do it in a hospital setup. Yes.
But for the urinalysis, they can do it from home.
If you're comfortable doing it.
Okay. Yes. And once it has been found out that this woman is pregnant, how soon do the clinics begin?
The lady should, or the client should come to the hospital immediately. Once you realize that you are pregnant, because there are things that you are supposed to assess for this pregnant mother. So immediately you realize you are pregnant, kuja hospitali.
Yes. So once they come to the hospital, let's say it's after 2 weeks, I'm a test and they're pregnant, now wamekuja, is that the onset of the antenatal clinic?
Immediately, it is between 0 to 12 weeks. So if a mother comes at 12 weeks, come at 4 weeks, come at 8 weeks, you attend that antenatal mother. And now you have to confirm. You also do the pregnancy test, utapima, so that you can ascertain this lady is really pregnant. Yes.
And now I understand pregnancy is broken down into the first trimester, the second, and the third. What does the first entail? What should a woman know what should a woman know about being in the first trimester of their pregnancy?
When the lady comes, the first trimester, that we have said is now from the time the lady realizes that she's expectant up to 12 weeks. We do a baseline investigation. These are the tests that we do. We have confirmed that she's pregnant. And now this one we call it first antenatal visit. You can check the amount of blood, kiwango cha damu kwa mwili yake. We call it HB. You can. You also have to do to screen for HIV/AIDS. You do the VDRL, that is the test for syphilis. You also do the blood group and the resus. If it is positive, it is negative, it's A positive, O negative, So that you know now where you place this mother.
Mm-hmm.
You have done, you do the urinalysis.
Mm-hmm.
The urinalysis is
Mhm.
where you have infection,
Mhm.
the current is
Mhm.
treated. Yeah?
Mhm.
You also have to cancel the mother.
Mhm.
You check her BP.
Mhm.
You check also the weight,
Mhm.
because those two they are going to continue until this mother
Mhm.
delivers. Yeah?
Mhm.
So you continue with the counseling for the diet,
Mhm.
and also you make sure this mother is comfortable.
Mhm.
You attend this mother.
Mhm.
It might be a new mother,
Mhm.
or maybe a mother who has given birth before,
Mhm.
but you attend this mother as if
Mhm.
there's no tomorrow.
Mhm.
You make sure she has everything
Mhm.
that need to know,
Mhm.
so that even if she goes out and someone try to give her
Mhm.
something else,
Mhm.
maybe a lay person,
Mhm.
the mother has knowledge. So you pack this mother.
Mhm. Mhm.
Even at this time, you can also do an ultrasound.
Mhm.
That will tell you whether the pregnancy is the uterus
Mhm.
inside,
Mhm.
or it is outside, or
Mhm.
it is in the fallopian tube.
Mhm.
That is like now the ectopic pregnancy.
Mhm.
Ile inaingia kwa
Fallopian
fallopian tube.
tube.
So it is also good. You can
Mhm.
do an ultrasound that time.
That can be assessed in the first trimester.
Yes.
And now, before we move forward, you mentioned something on rhesus factor.
Yes.
A lot of people don't understand what is it. Can you break it down for us?
Okay. This is where now you test. You get the client. You take the blood sample. And now you can be A, B. Then maybe the client is A positive. If this client is A positive, A negative, so let's say A negative, this pregnancy is at risk. Because if she's negative, maybe the husband is positive, and the baby in the utero, maybe it is positive. Though there is risk of maybe an abortion or miscarriage. And this is why we are going to tackle it in second trimester. When this lady should receive some drugs so that the pregnancy will be safe.
There is this issue of the rhesus factor to do with the dad, to do with the parents, with the mom and the dad, and the result affects the fetus. Yeah, what exactly happens? Or what is the right compatibility so that the child is not going to be at any risk?
If the mother is negative, the father is negative, we are good to go.
Oh,
yes.
All right. And do the signs in pregnancy wear off with this trimester, or do they persist to 9 months? The signs of pregnancy that a woman starts to experience.
Okay, to some extent, but most of the whatever the signs of pregnancy, some of them may disappear the second trimester. At 12 weeks, you find the mother is okay. But early stage, there are even a time that you have to admit the mother. And you administer drug and also give IV fluid so that can continue, the pregnancy can continue normally. But from the second trimester, you just maybe get a mood swing and also craving. You like to eat certain type of food. Yes.
But most of them are likely
They just
to disappear. And is it at this stage that you advise a woman what they're supposed to be eating, or the kind of a lifestyle they're supposed to be living during the pregnancy?
Yes. That's why I said when you meet this mother, you are supposed to cancel, and mostly on nutrition. There's healthy nutrition. And the classification is now not the way we used to say the balanced diet. We have now classification of 10 type of feed that the mother should have, at least 5 of them. 5 of them. Just behind maybe behind there, you can see the classification of maybe the type of food that the mother is supposed to eat. Yes.
And could you tell us how many antenatal clinics should a woman attend to, and how many of these fall in the first trimester? Because some women back at home, they tend to come to the clinics much later. So how many of these clinics are they supposed to attend?
Okay, initially, they were supposed to attend 4 visits. But now, according to the WHO guideline, they are supposed to have 8 visits. Yes. They start from now from up to 12 weeks and until this mother is at 40 weeks. So at 41 weeks, this mother is admitted now for delivery. Yeah, so there are 8 visits. Yeah.
Just to impact on people who are hesitant on coming to clinics, could you break down to us what exactly happens during these clinics and how is it going to have an impact, a positive one, on both the mother and the child?
It is important, as I have said earlier, to come to clinic immediately. The mother knows that she's expectant. Now the first visit, and elaborated what happened the first visit. So this mother is also now supposed to come the second visit, no, the second trimester at 20 weeks. At this time when the mother comes to the clinic, and maybe before I move on, the HB that we do, the hemoglobin level, that is amount of blood, ile kiwango ya damu that we need, it should be done every trimester, first, second, and third. The HB should be done. Before you used to do it maybe once. And then you do it when the mother is about to deliver or do it in maternity. But currently it should be done every trimester. So when the mother comes second, now the second visit is now the second trimester, you can do an ultrasound at 18, 20 weeks. This one you check how the baby is. You know the organs has already started developing. In case there is any problem that will be noted. Check her BP. Then check. You have to monitor the weight. You take her weight. Then this is the time now we are talking about the results. If he's negative, she's given a drug we call anti-D at 28 weeks. To make sure if the baby is positive, the baby is going to be delivered at term, and also there will be no other complication. Even for the next pregnancy, there will be no complication. Yes.
So, and what do you assess in the third trimester?
Okay, again, we have to do, we have to check the amount of blood that is this this. She's pregnant now. She's a pregnant mother. So you also do check her BP, and also the weight. And in each and every visit, we usually supplement these mothers with the ferrous and folic acid. So each and every visit, they're also supposed to receive tetanus diphtheria injection vaccine to prevent it now the baby. So the third trimester mostly is where you plan for the birth. This is at 30 weeks. Because at 32 weeks, a mother can go into labor and deliver. So this is the time that you prepare this mother in case this happens. Now from here, you're supposed to come to the hospital and maybe be attended to. And you remember in the first trimester, you talk, we are supposed to tell them about the danger signs. Yes. In summary, this is what I mean by trimester. We have the first trimester that starts from 0 or when the mother realizes she's pregnant up to 12 weeks. And here is it is the time now we do several tests to this mother. We do an ultrasound, we do blood tests, we do the urinalysis, we screen for HIV and TB. And also, it is the same. We also initiate a supplement like folic acid and ferrous. Now you go to the second trimester that you start from 20 weeks to 26 weeks. This is the time now you can also do an ultrasound now. This one is to confirm how the baby is and the development of the baby. You can also deworm this mother ili kupea huyu mama dawa za minyoo to prevent the HB from going down or dropping. We can also, this is the time the mother also feels that the baby is moving, there is fetal movement. And also at that 26 weeks, you can be able to listen the fetal heart using this fetoscope. So this is the one that you use. You can listen to the fetal heart. Now you go to the that trimester. Now this one you start from 30 weeks up to 40 weeks. And this is the time now you prepare the mother for the birth. This time the baby has grown. At that time, we have to check how the baby is. We have to listen to the fetal heart. You have to make sure you ask the mother if there are fetal movement, if the baby is moving. We also have to check her BP, check her weight, so that you can ascertain that this baby and the mother are healthy. Now this one goes, every month the mother is supposed to come for clinic. This one goes up to 40 weeks. Now at 40 weeks, now you advise the mother, if she has not given birth, she's supposed to come at 41 weeks and go to maternity direct. And they are now should be taken care of. Labor can start even early. If the labor start at 39 weeks, the mother should also go to maternity. So, but mostly if the labor has not started, the mother will come back at 41 weeks.
That's it for the 3 trimesters of pregnancy, a trimester being broken into 3 months, right?
Yes.
So let's see you in our next segment, because these clinics have results. So let us find out what are some of the complications that could be found in a pregnant woman and how are they handled. Stay tuned. See you in our next segment.
Kwigwatira rwimbo ruri na ihurwa Chris Mwangi, tasikiza tuni ya thimu yaku hinya star 837 star 2459 hash. Wigwatira rwimbo ruru, tasikiza tuni yaku.
Sharia hado ugithomera gukunya gita, piano kana migambo niyo vocals. Rehoboth School of Music maheyanaga mathomo ma kirathi kia iguru muno. Macerere Nyeri Town haria opposite Naiva Supermarket, kana waranirie nao kuhetukira namba cio cia thimu 0715 031 506. Rehoboth School of Music, cama wa rwimbo ni inanda.
Thank you so much for staying tuned in. Welcome back. Before we go to the danger signs during pregnancy, how does a healthy pregnancy progress?
Okay, a healthy pregnancy. The mother usually have persistent weight gain. She has to gain weight and add weight according to maybe the weight is supposed to. There is also the baby movement. Anasikia mtoto anacheza. And also when you listen to the fetal heart, when you come to the clinic, the midwife will listen to the fetal heart. This is how the fetus is. The heart is now pumping blood, so you feel the heart rate. And also we also check the fetal position. Hii ni ile vile mtoto amelala kwa tumbo, na hii ni kichwa imeanza ndio iko mbele. So we call it fetal position. That one you say this pregnancy is a healthy pregnancy. Yes.
And what are the danger signs for a pregnancy that is not healthy, or what should a pregnant woman see that prompts them to visit a clinic?
Okay. If this mother experience or have bleeding at any gestation, or gestation is any, maybe the weeks that we are saying from conception, even if it's spotting. Kama mama ameanza kubleed, you are supposed to come to the hospital. Then as the pregnancy advances, this mother feels that the baby is not moving. Kuna movement, and also this baby is not moving at all. So the mother should come to the hospital. If she develops fever, this is kona joto kwa mwili, and also maji kitoka. Anasema maji inatoka. So hii maji kitoka, they are supposed to come to the hospital immediately. The water breaks. And when she realizes that she's wet, her panty is wet, she should not wait, because this one will lead to infection. Also, if you check the mother, you check and you see her eyes are white, that is being pale. That means the blood level is low. This mother is supposed to come to the hospital. If this mother is swollen, amefura kwa mwili, uso, you wake up in the morning and you find your face is puffy, imefura, you come back, then mikono. The way that you know that you are mikono imefura, but the fingers are swollen. If you have a ring, you just see it. If you don't have, if you do your fingers like this, you feel that, you know, you are swollen. So this mother is also supposed to come to the hospital. If there is a conversion, this is like the mother will behave like this under epilepsy. This one, the relatives are the one that now sees that they are supposed to bring this mother to the hospital. Another is severe headache. The mother experiences very severe headache or severe abdominal pain. Tumbo anasikia inauma, she's supposed to come to the hospital. Those are the danger signs. Yes.
While talking about the danger signs, you have told us about baby movement. When does it start?
From 20 weeks, you feel the baby is moving. You just feel the baby is moving. And this is something that I want to clarify for mothers. There is fetal kicks. And this one the mother should check when from that weeks, or when they are about to deliver. There's difference between the fetal kicks. A kick is when you feel you are being kicked. You can even see maybe you think it's an elbow, and you can even see it. The baby is really playing. That one you differentiate it now from the movement. The movement, you just feel the baby. If you sleep, if I sleep, you feel the baby has moved to this side. But the kicks are important, because the mother might come and say, I was feeling the baby moving maybe 2 hours ago, yet the baby died maybe even 3 days ago. They should be very careful about the kicks, because the mother knows wakati mtoto anacheza. He knows how the baby, anajua the pattern vile mtoto wake anacheza. So this mother should now differentiate between that, the kicks and the movement. And this mostly is now from the 3rd trimester. Yes.
So the kicks signal that the baby is healthy.
Yes.
And the movement is the vice versa. It should alert you something is wrong.
Okay. The kicks, you make sure, you know that the baby is alive, is playing. They have time to play in the uterus inside them. And also, if the movement is okay, But now the mother should differentiate. I have felt a movement is okay, but I have not felt the kick. When the baby grows, the baby is supposed to play. It's not like the small one, maybe the 12 weeks, and there maybe 20 weeks. But as the baby grows supposed to, you feel the fetal kicks. Yes. Yeah.
And you've also talked about women getting swollen faces.
Yes.
But as a symptom, I hear some ladies saying their noses become big and their face gets swollen. So how do you know? How do you tell that now this is a health concern and this is just a sign or a symptom of pregnancy?
That is a danger sign. You know, like now I wake up, I'm pregnant, then I find my face is swollen. That one I should go to the hospital because there is a condition that will make your face swollen. If you come and find the BP is very high, and it is a danger sign, and the mother comes for admission and to be monitored in the hospital.
They should not see it as normal.
Yes.
Okay, and not all pregnancies get to the 9 months women miscarry. What brings about miscarriage?
Okay, the pregnancy can terminate itself from maybe the time the mother conceives, and maybe before that 7 weeks. So there are several causes for that, for the pregnancy to terminate. This is when the mother loses her baby before that 7 weeks. There are several causes. Maybe when the baby is in the uterus or inside her womb, we have the cord. In Kikuyu, we call it rorera. It can go around the neck and tighten and maybe kills that baby. Nature itself is able also to eliminate maybe a baby that has congenital abnormalities. These are the baby that is born with the wade. I can sit in Kikuyu so that I can simplify. This baby maybe does not have limbs. Those abnormalities, the pregnancy can, the nature eliminate that. Another thing is the placenta separates. The placenta is the one that feeds the baby. If it separates early, the mother will start bleeding, and you see now the pregnancy will be terminated. Also, hormonal imbalance, and also the other cervix. The other cause is caused by cervix. If the cervix opens early, the cervix is short, ni fupi, it will just expel the baby because you know you bear the weight. But that one, if diagnosed early or the mother comes, she'll be able, the baby will be saved. Yes.
Some women have their miscarriage as early as in the first trimester, and others later during the pregnancy. Is there a factor that brings about this difference in times, or is it just about the woman?
One in early pregnancy, that we can have hormonal imbalance. And also, if the implantation of the placenta, maybe this woman had a baby before, and maybe lost this pregnancy, maybe after 6 or 4 weeks, 6 weeks, she conceives again. And now the baby attaches itself to a place where there was a node scar, the pregnancy just maybe terminated. For the late pregnancy, the loss of baby can be like that one of maybe the baby has the cord, the rorera around the neck. It will struggle the baby, and the baby will just die. The placenta separates itself, and the mother starts bleeding. The baby will die in the uterus. Yes.
After a miscarriage, how soon should a woman get pregnant again? What are the favorable intervals that are not going to affect her health?
Okay, she should not get pregnant immediately. But if she has 3 menstrual cycle, complete and successive, she can become pregnant. Yes.
We also have some women who are pregnant and at the same time they have ovarian cyst. Can that be treated? Is it going to affect the pregnancy?
No. These can get treated and do not affect the pregnancy. Also, the ovarian cyst will not even affect the fertility unless it has an underlying cause. But it is okay. The pregnancy will just go on. Yes.
And someone is asking me, we are talking about ovarian cyst. What is it?
This is a bag that has fluid collection. Yes. So that is now what we call a cyst. This is just a fluid in a bag. Yes. Yeah.
And we also have women who get pregnant and then the baby attaches in the fallopian tube. Is that also, we could call it a complication? How is it dealt with?
That's why we insist on ultrasound the first trimester, because now this is diagnosed. The pregnancy will be terminated because this will also be an obstetric emergency. It will be an emergency when that baby grows and go beyond 8 weeks. It will rupture the tube and expel, or the tube is expelled from the fallopian to the abdomen, and that now is a risk and an emergency. So I still insist on ultrasound at the first trimester. It's an abnormal pregnancy. Yes.
And it cannot carry forward. It just has to get terminated.
Yeah. Okay. You cannot. The pregnancy will terminate itself at maybe at most 8 weeks. It cannot grow there. You know, the fallopian tube is small. It's not like the uterus where the baby can grow. Yes.
So we have some women where we hear cases of the pregnancy starting to grow in the fallopian tube. What is that complication and how can it be handled? Can that pregnancy grow to maturity, or what exactly happens?
Okay, this is the pregnancy. Instead of carrying the uterus at the right place, it implants itself the fallopian tube. So when the pregnancy implanted the fallopian tube, this pregnancy cannot go to term. This is where if a mother comes and we are certain that she's pregnant and she comes with the pain, we take the test, sure she's pregnant in the early trimester, the pregnancy is supposed to be terminated because the pregnancy cannot grow in the tube. That is, now we do a surgery and we remove the fetus. Yes.
And what are some of the signs that are going to prompt a woman that their pregnancy could be an ectopic pregnancy or a pregnancy that is growing in the fallopian tube back at home now?
Okay. They usually have pain on the lower abdomen, either the right side or the left side. If this pregnancy bursts, the tube bursts, the client will feel weak, and sometimes they even faint. They faint and then they wake up. And if a client comes complaining of pain and fainting, that now you do an ultrasound and confirm it's ectopic pregnancy, and now you handle is an emergency. Yes.
Other than these complications, you also have women who are pregnant and they have other underlying chronic illnesses, for instance, cancer or diabetes. Could they be classified in that category where this is a risky pregnancy, and how do you help them arrive at 9 months safely?
Okay, if this mother conceives, she's diabetic, she's hypertensive, and akona cancer, but mostly the hypertensive mothers are diabetic. Those we classify as high risk because this pregnancy has its own risk. Okay, they'll come to clinic as do the normal routine, what we usually do for other mothers, but this mother is being seen by a specialist called a gynecologist. Yes, for the treatment and also make sure the pregnancy will go up to term. If the pregnancy will not go up to term, there's a time that the doctor can give some medicine so that the baby lungs can mature, so that when the baby is born prematurely, the baby will be able to breathe by itself. Yes.
Pregnancy is much easier when you liaise with your health provider. So make sure you do that so that you can get to 9 months safely. When we come back, we're going to be talking about delivery. Stay tuned.
Caria handu ungithomera gukunya gita, piano kana migambo niyo vocals. Rehoboth School of Music maheanaga mathomo ma kirathi kia iguru muno. Macerere Nyeri Town haria opposite Naivas Supermarket, kana waranirie nao kuhetukira namba cio cia thimu 0715 031 506. Rehoboth School of Music, cama wa rwimbo ni inanda.
Welcome back for our last segment. Let's talk about delivery now. We've had this baby for 9 months in the womb. Now let's deliver this baby. So what are labor pains and what are the signs of the labor pains that will prompt you to know now you're about to deliver your baby?
Okay, the labor pains, these are now the contractions. Or this mother will come and say, I'm having pain and my abdomen is hardening. Now how it starts, if maybe the mother comes at around 38 or 39 weeks, and not necessarily the 41 weeks. So the mother will say she is experiencing pain from the lower abdomen, hapa chini, inaenda kwa mgongo. Then she'll say the interval is decreasing. Maybe she has experienced that an hour ago. Now she says now after maybe 45 minutes, I'm having that pain and goes back to, start from hapa chini, then inaenda kwa mgongo. Then there is breaking of water. The mother can break the liquor, and now the mother should come to the hospital. There's also the hardening of the abdomen. When the contractions come, that pain comes. There's also the hardening of the abdomen. Also, there is a discharge that she explained and say, I'm having a discharge, a mucus, kama makamazi, lakini it is brownish ama iko na damu kidogo. Now you know this mother is in true labor. Yes.
Are there chances that this could come before the 40th week or the 39th week?
Yes, even 38, even a teenage gestation. But now we are talking about when a normal labor that now we start at 39 weeks. Yes.
And what makes it, what are the parameters that this woman is going to give birth through the natural way? And CS, how do you, what exactly happens so that a woman cannot give birth naturally?
Okay, a woman who has carried a normal pregnancy, you come maybe to maternity. There is a way that we assess this mother. You listen to the fetal heart rate, the way that heart of that infant it is. Then you see how the position is. If the position is okay, the fetal heart rate is okay, then you allow this mother to progress into the normal labor. However, the mother will continue into labor, and maybe at one point, this mother maybe have other complications. The contractions maybe are not enough to compel this baby to come out. Maybe the baby is big. Also, the position is not okay. when the baby, the uterus, when the contractions comes, is the one that compels the babies to come out. At one stage, the baby maybe might stuck. And that's where now you see if the fetal heart rates are now irregular, you have to intervene, and now you can take in this mother for a cesarean section. But if there is no complication, you allow this mother to deliver normally. Yes.
What are some of the risks that are associated with CS, given that most women in this generation would actually prefer to go through CS over the normal delivery, as much as they're healthy and as much as everything is okay?
Okay, a CS is a mode of delivery, and this one will be performed if there is an indication of there is a reason for it to be done or to be performed. One of the risks of cesarean section is bleeding. It's what we call hemorrhage, is bleeding. Another complication is the infection of where the incision or where the mother was cut, and also pain. This mother will also stay in the hospital. There's that discomfort of delivery, and all that's not like a mother who have delivered normally. Yes. Yeah.
And once a mother delivers through CS, what are the intervals and how many kids can they get through CS?
Okay, you cannot say maybe quantify how many kids the mother can have, but just know any delivery has its own risk. There are some who come third delivery via CS, the fourth delivery via CS. So I think the one who had many deliveries were 6. Many deliveries, there were 6 via the CS. But you know now, even that uterus is now becoming weak. The other complication that will come, like maybe if she happens to go into labor and she's very far, there is something can happen like the tearing of the uterus. Yeah, call it the rupture of the uterus. Yes.
And we have cases where it has been a normal pregnancy. The mother was healthy, the child was healthy, but we lose either or even both during delivery. What causes that?
Okay, mostly hemorrhage, that is bleeding. That one, you kill the mother. Let's say the mother comes and the placenta separates before. And there is that bleeding that you cannot see it. Maybe just small amount of blood that you just see, that will not warrant you to get so much worried. And just now, the amount of blood that is inside is a lot, it's concealed. That one will kill the baby. If proper interventions are not done, you might lose this mother. So that's why we urge the mothers, in case they have any complication, even if the pregnancy was okay, the mother to go to a hospital for delivery. Yes.
That's where we wrap it up for today. Thank you so much, Nurse Lucy, for giving us so much insights. As we wrap this up, maybe you have some insights to share or someone you want to say hi to using that camera kindly.
Okay. Thanks a lot. I just want to tell the mothers, come to the clinically, get your baby be checked, your pregnancy be checked thoroughly, come for hospital delivery. And for this, I would like to say hi to my colleagues, also to my mom who is at Karima, and also my brothers and sisters, those who are watching, and all my friends. And special thanks for the GTN for giving us this opportunity. Yes, thank you.
Yeah, we are humbled and honored to have you, and even another time. See you in our next episode of the Medicamp Show here at GTN TV. This coming Tuesday, we are going to be talking about infant health. I have been your host, Mumbi Mavuti. Remember, your health is your wealth.